And now on the line is Ciara Smullen from Sightsavers. Ciara, welcome back to Near FM.
Thanks very much, Darren. Thanks for having me.
Okay, today is my third interview with your organisation, Ciara. I last spoke to you on Near FM about this time 3 years ago. I have to say that I love the work that your organisation does, Ciara. As this is our first interview in 3 years, though, Ciara, could you remind our listeners a bit about who Sightsavers are and the kind of work you do every year?
Of course, it would be an absolute pleasure. So Sightsavers is a global organisation whose vision is a world where no one is blind from avoidable causes and where people with disabilities can participate equally in society. We work in more than 30 low and middle income countries worldwide, mainly focusing on Africa and Asia. We very much believe everyone has a right to healthcare, regardless of where they are born, where they live, or how much money they have. And Sightsavers works around the world proving that what is possible when people work to strengthen health systems with local partners. So by doing this in the countries where we work, we partner with local, regional, national and international organisations, governments and non-governmental organisations. And with their help, we distribute treatments to prevent disease, to carry out eye operations and eye examinations. We train health workers and we advocate for the rights of people with disabilities. And I suppose when we're speaking about this, it's important that we put it into a global context as to why we do what we do. And I think the last time actually I was speaking to you, the statistics had come out from the World Report on Vision that was released by the WHO in 2019. And it very much provided some stark numbers in that at least 2.2 billion people, which is over a quarter of the world's population, has a visual impairment, of whom at least 1 billion people could have been preventable or treated. And as I mentioned, Sightsavers aims to address this by providing eye surgeries, treatments and training eye care workers to provide vital treatment.
Okay, this is a big question, Ciara, and you may have touched on it there already, but can you tell me a bit about the evolution in the provision of treatment for the people you work with over the years? Like, in other words, I'm just wondering if your work and that of your partner organisations is on an upward trajectory in terms of the number of people getting helped every year?
Sure. So since our work began, we've helped carry out more than 11 million sight-saving operations. And each year we see the number of people we reach through our programs grow. The COVID pandemic certainly was a significant challenge of late and stalled our progress somewhat, particularly in 2020, as you can imagine. However, even in the face of this challenge, Sightsavers has been reaching milestones that we can celebrate. One such example of recent success, very recent success actually, in the fight against avoidable blindness is Malawi. Only last month, the WHO confirmed Malawi as the first country in southern Africa to eliminate the infectious eye disease trachoma. Now, for those that aren't familiar with what trachoma is, it's the world's leading infectious cause of blindness and is a part of a group of conditions called the neglected tropical diseases. Trachoma, it's a disease of poverty affecting mainly women and children in hot, dry and dusty areas, spread by flies and cross-infection, such as unclean hands and towels. After years of repeated infections of trachoma, it causes trichiasis, and this is when the eyelid turns inward, causing scarring, terrible pain and eventual irreversible blindness. But in the past 20 years, the number of people at risk of trachoma globally has dropped by 92%, from around 1.5 billion in 2002 to 125 million today. But the condition still affects people in more than 40 countries, the vast majority of which are in Africa, but no longer in Malawi, where we began work in the 1950s and helped launch the Malawi Trachoma Elimination Programme in 2014. And through significant collaboration with Malawi's Ministry of Health and local partners there to implement the WHO-endorsed SAFE strategy, it's resulted in this success, which is the SAFE strategy is a combination of surgery, antibiotics, facial cleanliness and environmental improvements, and this helps stop the spread of infection. So on the 21st of September 2022, just last month, the World Health Organization officially announced that the country had eliminated the disease as a public health problem. This achievement is following quickly in the footsteps of Ghana and the Gambia of recent years, demonstrating what kind of success can be achieved through this type of collaboration. So certainly there is a huge difference being made in the last 20 years anyway, definitely, Darren.
Yeah, it's great to hear the progress, not just in Malawi but around the world with trachoma. And I think you were saying you work for partner organisations. Do you, are there many other organisations around the world? Can you tell me who work in the same areas you work in?
There would be, yeah, absolutely. There'd be many health organisations and international organisations, and we would also collaborate with them as well in initiatives like this to ensure that trachoma is on its way to elimination. And because we very much believe in collaboration, and that this is that working with organisations that have the same vision and the same ethos as us will help this mission as such, you know.
Yeah, and I know you have an office in Ireland. Do you accept volunteers from Ireland every year to go abroad, or what's the story?
We don't really, Darren. So what we focus on is building capacity in the countries where we work. So what we're doing is focusing very much on training health workers in each of the countries where we are, and health professionals, ophthalmologists, because there is a huge shortage of health professionals in the area of eye health in many of the countries where we work. So our focus is very much on the training of those people, so then they can give back, I suppose, as such in their own country.
Okay, we'll move on. It's great to hear all that new information there, Ciara. Okay, this Thursday, the 13th of October, is World Sight Day 2022, and this is the main reason I got in touch with you today, Ciara. Can you tell our listeners a bit about World Sight Day every year and what celebrating the day means to you in Sightsavers?
Sure, absolutely. So I referred earlier to the stark numbers that were released on the World Report on Vision, that worldwide at least 2.2 billion have a vision impairment, of which 1 billion have a vision impairment that was completely preventable. What's also stated in the report is the prevalence of blindness in many low and middle income countries is more than 8 times higher than in all high income countries. So World Sight Day for us very much gives us the opportunity to highlight this issue and to use the day as a platform to voice that in order to achieve the UN's global sustainable development goals, eye health is very much essential to this, because good eye health has a ripple effect in improving education, improving economic and health outcomes. So just for example, over €360 billion a year is thought to be lost in productivity because of visual impairment, because half the population worldwide are unable to access the eye care they need. So World Sight Day gives us the opportunity to prioritise this kind of messaging among the public. Closer to home then in Sightsavers Ireland, in Dublin, we use World Sight Day as a day to challenge our supporters to take on the Croke Park Abseil. And we've been doing this now since 2019 with our partners Adventure.ie. And this year, it's taken place obviously on Thursday on World Sight Day. This year we're delighted to have one of our incredible ambassadors, Dr. Sinead Kane, who herself has only 5% visual ability, and she's joining us to take on the challenge of the Abseil with us in Croke Park. So we're really excited about that.
Okay, that's cool, Ciara. Okay, to come towards the end of our interview, if you haven't already answered this question, can you tell me if you have any big development plans in Sightsavers over the next year leading us up to World Sight Day next year?
Darren, we'll very much continue to call on governments, donors, decision makers, NGOs, and other partners that I mentioned earlier to work together to prioritise eye health. very much to recognise the importance of eye health in achieving development goals, to integrate eye health into global and national health and education policies and programmes, and to invest in inclusive eye health services with a particular focus on women and girls. So we will very much continue that type of messaging over the course of over the year and up to World Sight Day next year. Next year actually is a big year as well for Sightsavers Ireland, in that we will have been we'll be celebrating our 20th anniversary. So we have a couple of flagship campaigns as well that will be running amongst the Irish public. So we'll be very much looking forward to talking more and more about eye health next year.
Yeah, I'll come back to you definitely next year for another interview about World Sight Day and your 20-year anniversary. Just one more question I just thought of now. I don't know if you are or were involved in it, but I remember some years ago, I think it was Specsavers used to have a kind of thing where if you had glasses that you didn't want anymore, you could give them to them and they would send them to developing countries, whatever. Is that still on the? I don't think that's still on the go, because I was in Specsavers a few years ago and I asked them, "Are you still doing that?" And the woman said no. Do you know any more about that?
No, they wouldn't have been an organisation we were working with on that, and it's not something that we do or we tend to do. Basically down to logistics. But also, when we like to kind of empower the people that are benefiting from the glasses when they're in the country, so they get to kind of choose the glasses that they're getting as such. So it isn't something that is part of our programming at the moment, though, Darren.